State is designed to get people to give up one culture and accept another one.
No, I don't.
Completely
I don't.
change
I think
study comes out.
Just suppose it doesn't work that way. Okay.
John,
Isn't it the case
I'm sorry.
that people will not be allowed to take money out of their own pocket and go pay more money to see a really good doctor?
No.
The administration is not going to allow that, is it?
No, they can
You're
do that.
level. Everyone, except maybe Bob, admits it's been a total failure. We spent $5 trillion on the welfare state. We have a higher poverty rate today than we had when the war on poverty began. Wherever we look in the country to find poverty programs that work, they're all in the private sector.
Well, we
So what we want to do
we have a lower poverty
is
rate.
have a real problem with the race to the bottom in the exchanges. MD Anderson in Houston is probably our best to every detail. But the broad structure of the plan will bring capital to the United States. Middle class will gain because avoid sick people. Healthy people tend to buy on price, which means premium. Sick people, well, what we need to do is we need to extend that tax credit that's now in the individual market to people at work. Well, the big mistake that the Republicans made was they are repealing $1 trillion.
In the Red File tonight, Congress needs to get with the times, according to a new study from the Goodman Institute for Public Policy Research.
Hi, I'm John Goodman, and I want to welcome you to the Goodman Institute for Public Policy Research.
And now we will go into all of the really great ideas that Dr. Goodman is going to be speaking to you guys about. We will have time for questions at the end, but feel free to drop in the chat if a question comes up while he is speaking, if you have something that you think of and you don't want to save it for later. So welcome, Dr. Goodman.
Thank you, Nicole. I just didn't recognize the individual in those film clips that you showed us, but I guess we can go forward. You know, if you Google the idea of inequality, you're going to find all kinds of numbers. You're going to find all kinds of competing claims. And what I thought I would do with you for the next few minutes is go over three big issues that economists have a lot to say about and see if I can sort through all the contradictory claims that you're going to be hearing. The first issue is whether or not inequality between the top and bottom of the income distribution has been getting larger over time. In other words, have the rich been getting richer and the poor getting poorer? There's a group called of economists, Piketty, Zatz, and Zuckman, who, if any affirmative team is claiming that inequality has gotten worse over the last 50 or 60 years, they're probably going to be quoting from those guys, one of their studies. And for a long time, they dominated the field. But then two other economists called Austin and Splinter came along, and they said, well, the Piketty research is faulty, makes 10 big mistakes. And one of the mistakes is they ignored employee benefits. For example, workers get health insurance and pensions from their employers. And for a lot of workers, that's 20 or 30% of their income. But even bigger than that, the Piketty study ignored government taxes and government spending. Now, in the United States, this is a big deal. We distribute more money from the top of the income distribution to the bottom than any other country in the world. Some other countries have more social insurance than we do, but no country shifts more income as a share of GNP from the top to the bottom of the income ladder. What did Alton and Splinter, our two other economists, what did they discover? They discovered that when you make all the right corrections, over the last 60 years, there's been almost no change in the income of people at the top to the people at the bottom of the income ladder. Now, if that doesn't knock your socks off, it should, because think about all the changes that have occurred in the last 60 years. We had the war on poverty. We have Medicare, Medicaid, food stamps, 95 different entitlement programs. And then on the tax side, we have the earned income tax credit, the child tax credit. We've kicked half the population off the income tax rolls. And yet after doing all of that, we haven't really changed the relationship between people at the top of the ladder and people at the bottom. Now, it's easy for an affirmative team to say, look, our plan is to take from the rich and give to the poor. But you have to remember, people have been saying that for 60 years. And most of the affirmative plans I've seen are pretty small potato in comparison to things we've already done. So I would say that there's an affirmative obligation here to explain why they think their plan is going to succeed in affecting inequality when none of these other changes have. And that's not going to be an easy burden to meet. Now, our two economists, Alton and Splinter, did find something that's rather interesting. No real change from the top to the bottom over 60 years, but there has been a significant increase in inequality, and it occurs in the middle. So people in the middle have, in the words of Charles Murray, been coming apart. He wrote a book with that name, and in that book, you'll find the best information on this. But what's happening is that some families are leading what I would call a conservative lifestyle. They may be liberal in their politics. They may vote for Democrats on election day, but in their personal lives, they're pretty conservative. By that, I mean, they get married and stay married. They go into the labor market and they stay there. A lot of them go to church on Sunday. They don't abuse alcohol. They don't abuse drugs. And over time, their economic fortunes have been going uphill. On the other hand, we have a large group of people who do the opposite. They don't get married, or if they do, they don't stay married. They don't go into the labor market, or if they do, they don't stay there. They don't go to church on Sunday. They abuse drugs, they abuse alcohol, and their economic fortunes are going downhill. So these are the groups that are coming apart because of their lifestyle. Now, I've seen a number of affirmative plans that have been floating here and there, and I've not seen one yet that really deals with this fundamental increasing inequality, but that's because it's occurring in the middle of the income ladder and not at the top and at the bottom. Now, the second issue I want to address with you is how we measure what's happening to people at the bottom of the income ladder. Almost every statistic you see on poverty level individuals and families is coming from the Census Bureau. That's what everyone relies on. And the Census Bureau has a lot of good information, but it has never in its history put out a thoroughly comprehensive, accurate explanation of what kind of income people at the bottom of the income ladder are getting, or how much is being spent on their behalf. Usually what the Census Bureau does when it publishes poverty statistics is it leaves out all the in-kind spending. Now, that's unfortunate because the war on poverty gave very little cash to poor people. All the spending is on in-kind benefits: Medicare, healthcare, education, food stamps, housing. Those are all income, in-kind benefits, and the money goes to someone else. Now, if you count all of that spending as equal to spending in the form of money in the form of cash, then the book by Phil Graham and his colleagues takes Census Bureau information, the very best information we have, and it estimates how much income is available for each of the fifths of the income distribution. And it turns out that at the bottom, we have per capita income of $33,000 a year. So for a family of four, that would be $135,000 a year if you count all the spending on their behalf as valuable as cash income. And it turns out that that number is higher than the number in the fifth above them and the number in the middle fifth. So people in the bottom fifth either have more cash in their pocket plus in-kind benefits than people in the next tier and the tier above that. Now, one problem with all that is that low-income folks don't always value the programs that are created in their behalf. So if you take Medicaid, for example, very careful studies have determined that people who are enrolled in Medicaid value Medicaid as little as 20 cents on the dollar. And what that means is if you ask someone enrolled in Medicaid, how much would you sell your insurance for? They would sell it for as little as 1/5 of the cost to taxpayers of that program. So one very interesting case I would think for the affirmative might be to take all these in-kind programs where the money is going to someone else and convert it to cash income to low-income families. And that would be redistribution because right now the money is not going to the poor. Healthcare dollars go to doctors and hospitals. Food stamp money goes to agribusiness. The housing money goes to landlords. Education money goes to the education bureaucracy. None of those people are poor. But if you converted that over to cash income to low-income people, that would be a significant redistribution, and I would think it would be inarguably a good thing. Interestingly, the most helpful programs for people at the bottom of the income ladder are cash programs. Now, the Democratic Party has tended to favor in-kind benefits because they created the war on poverty, but the Republican approach has been more toward cash. The earned income tax credit, the child tax credit, that puts cash in the pockets of low-income people. And interestingly enough, by the year 2018, a mother with children, it was impossible for her to be poor because of those two tax credits. And by poor, I mean in terms of money income, even if she worked full-time at the minimum wage. And by minimum wage, I'm not talking about $17 that McDonald's probably pays an hour today. I'm talking about $7.25 an hour. So these are two powerful programs that put money in the hands of low-income folks. And along the way, we threw half the people off the tax rolls as a result of Republican tax reform. So those programs, which affect cash in the pockets of low-income people, have made a significant difference. Now, the third issue I want to raise with you is what is the right way to measure the well-being of people? And all the statistics I've been citing so far, and all the statistics you're probably going to find if you go on Google, are treating people as though they're all alike. For example, we talked earlier about people at the top of the income ladder. If you take the people in the top 1% over 60 years, and you take the bottom fifth of the income distribution and compare them, that's what the economists were doing. But how do people get in these categories? What they're doing is they're treating someone in the workforce, say middle age, as the same as someone who's 80 and retired. They're treating someone who is just entering the labor market, starting out on a career, as someone who's at the peak of his career. They're taking a medical student who may be working at a minimum wage in medical school and treating him as poor, even though in a few years he's going to have $200,000 or $300,000 of income, and he'll be at the top of the income ladder. So all the numbers you see about who makes what difference it makes are comparing really apples and oranges. And the only folks who've done the right kind of comparison are my colleague Lawrence Kotlikoff at Boston University and his colleagues. And what they have done is they do two important things. They compare people at the same age. So we're going to compare 40-year-olds with 40-year-olds, not with 80-year-olds. So 40-year-olds compare 50-year-olds, 60-year-olds, and we're going to look at lifetime income, not the income they happen to be making today. And that is the accurate way to do it. So if you're on the negative and the affirmative starts coming up with numbers about income, you can legitimately say, well, those really are not very accurate numbers because of the mistakes I just mentioned. Now, I want to say two other things about the numbers you'll be looking at. One is that we tend to talk about people as though they're in the same category for a long period of time. For example, the top 1% over 60 years, that's what Piketty talks about. But Piketty is a Marxist. And Marxists tend to think, well, there's this top layer of people, and they pass their wealth down from to their children and into their grandchildren. But in fact, that's not what the top 1% is. The top 1% over 60 years is constantly changing. And people move into that category, and then people move out of that category. So it's in constant flux. And by the way, all the material I'm giving you today is on our website. We have a debate site, and you can go there and you can find the authors that I'm talking about, and you can find summaries of their work. The other thing I want to point out to you is that we really shouldn't be talking about income as much as we talk about consumption. If you take Warren Buffett, he's one of the richest people in the whole world. He's a stock market guru out in Omaha, Nebraska. And you can actually go on the internet and find out how much he spends on breakfast. It's $3.17. That's all he spends every morning. This is a very conservative lifestyle, even though he's worth billions of dollars. So what does Warren Buffett do with his money? He puts it in the capital market. And the important thing is that when money goes into the capital market, it's available for investment. We need investment dollars to raise worker productivity. When worker productivity goes up, wages go up. We have economic growth. So money in the capital market benefits everybody. And it doesn't really benefit Warren Buffett unless he takes it out and doubles the amount he spends on breakfast. That's why a lot of economists, including me, think that we shouldn't tax income at all. We should tax consumption. When Warren Buffett's putting money in the capital market, he's benefiting all the rest of us. When he buys breakfast, he's benefiting Warren Buffett. Now, someone like Leonardo DiCaprio, who has a yacht, well, that's consumption. So if I had my way, I would tax DiCaprio a lot more than Warren Buffett because he has so much more consumption, even though Warren Buffett has many, many times the wealth of DiCaprio. Now, let me say a few words about inequality, and then we'll throw it open and have a few questions. Most of the discussion I've seen about this topic assumes that equality is good and inequality is bad. But I want to point out to you that people don't act like that's the case. In other words, when people walk into a casino, they know that by the time they leave at the end of the evening, that income is going to be less equal than it was before they entered. And yet there's a huge amount of gambling in this country. People know that when they buy a lottery ticket, that once the winner is declared, things are going to be more unequal than when they started. And yet millions of people buy lottery tickets. There is low-income people in Venezuela are just about all equally poor. There's a lot of equality in Venezuela, equally poor, and yet they're traveling up to the United States knowing they will start out at the bottom of the income ladder. So point is that people do not act in their own lives as though equality was the most important thing to them, and it isn't. Second thing I want to point out is that inequality is not obviously bad. There are a lot of good things that come about because we're not equal. If you think about IQ, for example, the average IQ is 100, and there's a lot of variation around the mean. And that's a pretty good thing, because what if that were not the case? What if we all had 100 IQ? Well, we would never have had Newton's laws of motion. We would never have had Einstein's theory of relativity. We wouldn't have quantum mechanics, and your lives would be very, very different today. So it's really good that there are some people who are 3 or 4 standard deviations away from the mean on the IQ scale. Even if you are below average IQ, you benefit a lot from people who are way above the average. The same thing is true of income. There's a relationship between IQ and income. All these young guys who've made millions of dollars in the high-tech industry, they all have very high IQs. And they turn out to have very high incomes in many cases, hundreds of millions of dollars, in some cases, billions of dollars. And it's not obvious that there's anything wrong with that. The rest of us benefit from it. There's an estimate, I think it's by Nordhaus, again, you can find it at our site, that the inventors and the innovators only get about 1 or 2% of the value that they create. In other words, the rest of society gets 50 times the benefit that ever goes that ever is received in the form of income by the innovator. The last thing I want to point out to you is, well, let's take the Industrial Revolution for just a second. Prior to the Industrial Revolution, the average person was living on the modern equivalent of $2 a day, a pretty bleak existence. Suppose everybody was living on $2 a day before the Industrial Revolution. Well, we never would have had the revolution. So the only way we could have taken new inventions and new ideas and turned them into products that work is because some people were accumulating capital. So it's inequality before we had the revolution that made the revolution possible. If that inequality did not exist, you today would be living on $2 a day if you were alive at all. The last thing I want to do is point out that there's a trade-off between equality and other things that we care about. And affirmative teams need to address that equality. If you can see my hands, imagine that this is the inequality that we start with. The affirmative team says, well, look, we want to decrease it this much. And we think that would be a good thing. Well, if that would be a good thing, why would this not be a better thing? And better still here, better still there. Why not here? The obligation is to explain what those trade-offs are, and if you want to reduce inequality, why the benefits are better than the costs. By the way, the country started out here. Jamestown colony had equal incomes. There was no relationship between what people consumed and what they produced. And the Jamestown colony almost starved to death. And then they went to private property rights, and there became some relationship between what people did and what they consumed. And they wrote about it. And this is an interesting fact in our history.
Yeah, okay, so now this is one of my favorite parts because I think you can obviously learn so much from a presentation and a speech, but really what's engaging is asking the questions that you guys came up with while Dr. Goodman was talking. So first I'll open the floor if someone wants to either unmute and ask a question or put a question in the chat, either about what Dr. Goodman said or maybe, an affirmative case that you've encountered where they ran a plan and you weren't sure the best negative arguments to run against it. Or maybe a question about your own affirmative case. Okay, well, while we're waiting, I'll just start us off and ask the first question.
Make it an easy question.
Okay. I told Dr. Goodman about this earlier, but I was just curious. I mean, obviously, as you guys saw from the video, he has done many debates in his life, both in the high school stage and format that y'all have done, going to state and nationals, and then also on national television, live television, in front of millions of people. So I am just curious, you guys might be as well, what Dr. Goodman's hardest debate that he has done. Maybe the topic. What topic was the most difficult?
The hard thing was debating with Bill Buckley. Now, Bill Buckley's show was called Firing Line, and sometimes he'd have guests on and go one-on-one. But the clips that you all saw a few moments ago were our 2-hour debates, where I was Buckley's debating partner, and there would be 4 against 4. And Governor Pete DuPont, who was a one-time presidential candidate, was also often with us. Buckley started National Review. He was known as Mr. Conservative back in before most of you were born. But the difficult thing about Bill Buckley is he wouldn't cooperate with us in preparing for a debate. I suspect that most of you are debating in teams, and you talk about what you're going to do before you go into the room and start talking. Well, Buckley didn't want to do that. And so Pete DuPont and I would show up to the debate. We had no idea what Buckley was going to say. That was kind of difficult. Even so, I think we held our own in those debates.
That's so funny. Guys, that's like showing up to a debate and you didn't talk to your partner at all.
Yes, exactly like that. Yeah.
Okay, we've got our first question. So this is from one of the students. They said, what is the most realistic non-governmental or non-federal platform to actually enact the resolution? i.e., they're asking, what is a good counterplan that doesn't involve state government?
Does not involve state government. Well, I've already mentioned one, and that is to take all the federal programs that are in-kind benefits. So that's healthcare, education, food stamps, housing, and there are many, many more. And give it to low-income folks in the form of cash. If they did that, if you gave it all to low-income folks in the form of cash for the bottom fifth of the income distribution, again, that would be $33,000 per person, $135,000 per family of 4. Now, think about that. I live in Texas, and I was reading in the Dallas News just the other day that a fifth of the children in Texas are hungry part of the time. And so we have all these different programs to provide free meals in the summer and free meals at school. But why would we need any of that if each child has the equivalent of $33,000 available each year? Then I read in the same newspaper that 1 out of every 11 people are using community health centers for their health care. And if they can't get care there, they're going to safety net hospital emergency rooms, where here in Dallas, you wait 6 hours from the time you enter, the time you leave. Why can't folks on Medicaid go to the same doctors and same facilities that everybody else goes to? Well, they could if they had control over the dollars and they were buying their own health insurance. So I think a very powerful case can be made for that kind of redistribution. And it would be redistribution from higher to lower income because, again, the people on the receiving end of the money for all these entitlement programs are not poor at all. Large hospital administrators make $1 million a year or more, so they're certainly not poor. And they make a lot of money off of Medicaid, while they have the Medicaid patient waiting down in their emergency room for 4, 5, 6 hours for their care. So that would be one suggestion. We have at our site a Social Security reform. There are all kinds of ways in which Social Security abuses seniors, and it's usually low-income seniors that are getting abused. And so what we suggested is a reform of Social Security that would get more money to low-income seniors without really costing the taxpayer much at all. Just to give you one example, last year Social Security sent out 2 million clawback letters. Now, clawback letter is a letter you get and says, look, sometime in the past, maybe 3 or 4 decades ago, we overpaid you. Now we want our money back. There was one individual who's midlife, he's disabled, and they sent him a letter and said, well, back when you were 21 years ago, when you were 11 years old, we overpaid your mother $4,000, and now we want our money back. Well, that's the sort of thing that we can easily remedy. And there are a lot of other examples that I could give you. So we have a Social Security reform proposal that reforms Social Security in surprising ways. I suspect it's a case that you haven't heard before, because the kind of reforms we're talking about are not discussed anywhere beyond my think tank and the people I work with.
Yeah, that's really interesting. While you're speaking, I think this is a follow-up question that has to do with one of the points that you made. One of the students asked, could the federal government cover politically just giving away $33K a year? What type of social reactions might we expect? Could anyone in Congress realistically be reelected?
We have to consider the fact that there's a reason why the war on poverty didn't give money to poor people. And it's because poor people are very poor at lobbying in their own interests. So think about where the money is going. It's going to all the big hospitals. They have lots of money, lots of lobbying power. And therefore, for them to support the program, they need to have their interests taken care of. And then the doctors, the American Medical Association, they get more money because of Medicaid. They used to be giving away a lot of free care. Now they get paid something. The housing dollars go to landlords. The education dollars go to the education bureaucracy. All these folks I'm mentioning have strong lobbies in Washington, and they want money for themselves. So considering that low-income folks are the least politically powerful group in the whole country, it's very, very hard to do. But I take it that in a debate, you don't have to necessarily argue that Congress will do it. You can argue it should do it.
That's true. That's true. I think there might be a follow-up question about that, but Marna hasn't sent it over to me. So we're going to hop over to the chat really quick. We've got 2 questions. The first is, if the top 1% constantly changes in America, how are old money families maintained in places such as Britain and other European nations?
Well, let's just talk about the United States. If you go down the Forbes 400 list, you'll see the Waltons. Okay? Sam Walton started Walmart and Sam's, and he was one of the richest people in the whole country. And he left an enormous amount of money to his children. And so those children are still on the Forbes 400 list as among the richest people in the country. But most of the people on the Forbes 400 list are new. I mean, they didn't get the money from their parents. If you think about the high-tech folks like Steve Jobs, who created Apple, and Bill Gates, who created Microsoft, and all the other high-tech guys who got rich, just many of them dropped out of college with a good idea and had successful firms. They were successful because they're really bright, they're entrepreneurs, and they had good ideas, and that's why you have your iPhone. It's why you have your laptop, because of what they did. There are worthless heirs, no question about it, but the worthless heirs aren't doing anything for us. The people who do things for us are the entrepreneurs. And it turns out, and I think this is at our site, maybe this is the estimate of Nordhaus, the typical inventor, the typical entrepreneur who invents a new product, a new service, gets only about 1 or 2% of the value that he creates for society. So the rest of us get 50 times the benefit that goes to the inventor himself. So that's a good deal. I think that's a fair deal for the rest of us, and I think it's the kind of thing we want to encourage.
Got it. So you're saying that it works the same way in Britain or other European nations where you have those select few families that are constantly on the list and then the rest is changing, or do you think that's unique to the US?
Europe has a tradition of protecting wealth more than we do. And I don't think we should protect wealth. I think people who have high income should compete in the market with the rest of us. There are some tax breaks for the wealthy that I would like to get rid of. I don't think we should tax capital indiscriminately, but it is possible for wealthy families to set up trusts, and the heirs, instead of getting money from the trust, borrow from the trust, and by the time they've died, they borrow all the money and they've consumed and never paid taxes. Those are the kinds of things I think we ought to get rid of. But going back to Europe, they have a tradition of not taxing capital, and that makes it easier for families to pass on their wealth. I might say, however, that a problem in countries like France and Britain are property taxes. And so what was happening in both those countries is their family would inherit, say, an estate, not really a castle, but a very large house, a mansion, if you like, and they couldn't afford the property taxes. And it was getting so, they were turning them over to the state. It was getting so bad that at some point, the British government said to the owners of the houses, the heirs, if you'll maintain the house and let the public come in and use it occasionally for events, we'll let you keep the house. And so, but mainly in Britain today, Britain is not dominated by people who have a lot of inherited wealth. Britain is dominated by entrepreneurs who made their money.
Got it. Okay. The next question is, what is your opinion on the 3 possible cases: basic income, federal jobs guarantee, and Social Security?
Well, I think the proposal I made earlier, we'll take all the in-kind money and give it to people. That could be your basic income. And the way traditionally I think of a universal basic income is you give it to everyone. But I've noticed that some people are getting away with saying, well, no, it's universal basic income means we guarantee you have so much money. And if you make more than that on your own, you're fine. But if you drop below it, then we supplement your income with federal dollars. So I think the proposal I gave you fits into, or could be argued to fit into, universal basic income. I have no idea why anyone thought that job creation would be helpful in this respect. The private sector is far more productive, more efficient. We have full employment. Why would one think federal jobs would add anything? The federal workers tend to be generally far less productive and overpaid relative to the private sector. And what was the Social Security? We have again a Social Security proposal, affirmative proposal. But I would certainly be against expanding current Social Security benefits. We have these are programs that have obligations going forward that are way above any expected taxes. So we don't have extra money to spend on these programs.
Awesome. Okay. Next question in the chat is, have there been any specific policies in taxing consumption over income?
Well, a sales tax is a consumption tax. Unfortunately, it tends to be very much influenced by special interests. So in Texas, we have a sales tax, but half the sales aren't covered by the sales tax. But that's a consumption tax. The most popular tax in Europe is a value-added tax. A value-added tax is a consumption tax. So every time you buy a product in most European countries, you're paying that tax. And by the way, that's the way European countries tend to finance their social welfare states. So I may have mentioned earlier that especially Northern European countries have much more social insurance than we have, broader healthcare programs and other programs, but it's funded through the value-added tax on middle-income people, not by taxes on wealthy people.
Got it. Yeah, one of the students had said a little bit later on in the chat, you mentioned the idea of a consumption tax, however, doesn't sales tax do the same function? So if I'm understanding correctly, you're saying that they are synonymous.
No, those are two examples of consumption taxes. A sales tax is taxes consumption. You pay it when you buy things. A value-added tax is also part of the price you pay. A much more efficient way to collect a consumption tax. And we could do that in this country, and we could replace the income tax that we now have with a value-added tax. There's a lot to be said for it.
Awesome. Okay. And then the last one from the chat for now is, how would you form your point on how equality isn't good and people will still participate in something even if it increases inequality?
Well, again, we're being invaded at our southern border. I don't know what the right number is, maybe 10 million over the last 3 or 4 years. People coming here knowing they're going to start at the bottom of the income ladder. If they stayed where they were, they'd be far more equal to the people they were living next to. They come here at the bottom of the income ladder. Why would they do that? Because of opportunity. So for those people, opportunity is more important than equality. And I think for most of us, opportunity is more important than equality.
Cool. Okay.
Since you ask, I'd much rather have lunch with folks that have a lot more money than I do than people who have the same amount of money that I do. People who have a lot more money than I do are more likely to give to my institute, enter business deals with me. I mean, many more things that I can obtain from a rich person than I can obtain from someone who isn't rich.
Yeah, that makes sense. Oh, I think my light timer went off. Oh, there it goes. Okay, this question comes from Marna, and he says, what role do governmental tax policies and cash benefit programs play in mitigating income inequality? How should their impact be considered in evaluating proposals to evaluate income inequality? Does the Goodman Institute have any one proposal on this you'd like to see become the law of the land?
Well, again, the best accurate measurement of what's going in the direction of people at the bottom of the income ladder is the Phil Graham book. And they came up with a number of $33,000 per person at the bottom of the income ladder. 90% of that's coming from government. So we have entitlement programs that has discouraged work. We have a lot less work among this group of people. Now, what does it do to eliminate poverty? Well, if we count dollar for dollar, if every dollar spent on in-kind benefit is just as valuable as a dollar of cash, then our lowest fifth of the income distribution has more to spend than the people in the fifth above them and in the middle fifth. But as I said, they don't necessarily value their Medicaid insurance at 100% of the money that's spent on it. So if we gave them, even though they're on Medicaid, they're still going to the hospital emergency room. In fact, whenever we've expanded Medicaid, we increase hospital emergency room visits by 40%. And that's because Medicaid pays so little that so many doctors don't want to see them, or if they do see them, they're the last patient they want to see. So we can make all this more valuable to low-income folks if we give them cash. If they have cash, they can buy everything you and I buy. You know, the walk-in clinics, minute clinics, and CVS. We have. I typed into Google the other day, urgent care near me, and I got a dozen or so links, but none of them have the word Medicaid in it. And even if they accept Medicaid, they're not located in the part of town where most Medicaid patients live. So we have really convenient non-emergency room care available to people like me, but not available to people who are dependent on Medicaid. But if the Medicaid enrollee had dollars, then they'd be going to the same places I go to when they needed care.
Okay, next question. What do you specifically mean when you speak of the pros of income inequality? Could you specify this? And then it seems like these two questions are interlinked. As an affirmative case, how could we structure a case to argue income inequality itself is a harmful system in light of living under capitalism?
Well, the affirmative proposition forces you to argue that way, and I think it's a tough argument. It's tough for some of the reasons I gave. That equality of income is not the highest value for most people, and they'd rather have opportunity. They'd rather have higher incomes, and they're not. People coming here aren't bothered by inequality. And remember how we got populated. We got populated by immigrants, and almost all those immigrants who came here were poor. So coming here poor, opportunity was more important to them than equality. But again, I think there are some ways to argue the affirmative case where our current system is so poorly structured, and especially our welfare system, that you could clean it up and make it so much better that would, I think, satisfy the topic and create more equality at the same time.
Got it. So you would recommend to structure an affirmative case to fix the welfare system that we have right now?
I think that'd be a very good case. Yeah.
Okay, and then a follow-up to that, any specific authors you could suggest?
Did you say authors?
Mm-hmm.
Oh, go to our website. And the book by Phil Graham is a really, really good place to start. Charles Murray's Coming Apart is really good if you care about how the middle class, not the really rich, not the poor, but the middle class is coming apart, and some are doing well and some are not. And that's where the inequality is really emerging. So those are two really good books. But I start with the Phil Graham book, because it's the one book which, for the first time ever, really tries to carefully measure how much we're spending on people in different income groups. And it also has some good stuff on how much mobility there is of people born poor and end up rich. It has good comparisons of the United States and Europe. A lot of good information there.
Great. Okay, and then one last question from Marta before we go back to the Zoom chat. He said, so far we've heard it would save money to just give $33K a year to each American. What authors would you suggest on how this would prove it is American to favor this sort of giveaway? I'm thinking of answering, how does this support the American work ethic type arguments in a debate round?
Well, you got to remember, we're already giving it away. We're just giving it away in an extremely inefficient manner. And the money is going to the pockets of people who are not poor. And you have to understand that the reason Medicaid works the way it works is not because poor people went to Washington and said, we want it this way. It's because the people getting the dollars want it that way. So these programs have been shaped and molded by lobbyists who are representing the interests of people who are not poor. So I'm not saying it's a good thing to give $33,000 per person to every poor person, but I am saying that would be better than the way we're now spending it. Maybe give half of the money to people who are not poor, but you replace a system that's pretty dysfunctional. I like to refer to it as a tattered social safety net. We're spending an enormous amount of money, and I think I mentioned earlier, 1 out of 5 children in Texas are said to go hungry at certain times during the year. When they need care, they go to hospital emergency rooms and wait hours for care. They don't have access to the urgent care clinics, the minute clinics, because they're not allowed to pay market prices. They have to pay the Medicaid price. Doctors aren't anxious to see them. If they see them, they're the last patient the doctor wants to see because they're paying the lowest rate. So these are programs that work very poorly. Considering how much money we spend on them, we're not getting a very good return. And we get a better return if we simply gave money to people. Now, what I like best is the earned income tax credit. Now, the earned income tax credit was called by Milton Friedman a negative income tax. And it starts out, and you, as you go up the scale, you get less help from the government. But it's a tax rate that's proportional to income, and it encourages you to earn more income. And so that's really more of an ideal form of welfare.
Got it. Okay. And then our next question comes from the Zoom chat. Is Social Security and universal basic income a communist idea?
A what?
A communist idea.
No, I wouldn't say so. The idea of communism, it used to really mean something, but what it turned into very, very quickly, they used to have the phrase, from each according to his ability and to each according to his need. Yet once Stalin took over Russia and Mao took over China, there was hardly any redistribution from the able to the needy. And so the peasants worked near starvation, and the people in charge of the government lived in luxury. And that's happened in North Korea, and also happens in Cuba. The leaders literally live in luxury, and most of the people don't get the benefits of a market economy.
So the last question here in the chat is, what do you think is the best form of tax to fund welfare programs? What do you think about a carbon tax?
Well, first place, the best form of tax is a flat tax. A flat tax, which is actually a consumption tax, because it would be a tax on income that you use for consumption. If you wanted to save money, you wouldn't be taxed on the money you save. So that's an ideal form of taxation. We encourage savings, but we only tax money that you use to consume. And it would be a flat rate, the same regardless of your income. For global warming, climate change, all economists are agreed that the best, if we need to do anything, the best thing to do is a carbon tax. And a carbon tax is like 6 times more efficient than anything else that people are talking about. Far more efficient than giving subsidies to different forms of green energy and other things that people have come up with. There's obviously a political problem, and so Congress doesn't want a carbon tax because it doesn't want to increase the price of gasoline and get thrown out of office. But for the economists, I don't care whether they're conservative or liberal or what they are, everybody recognizes that the carbon tax, if we're going to do something, is the right way to go. And why? Because it puts a price on carbon. If you want people to reduce their consumption of carbon, then you put a price on it, and they'll figure out the best ways for them to do it. Then you get efficient responses. You try to do it some other way, and you have a huge amount of waste.
Got it. Okay. And one more question coming from Marta. The resolution specifies fiscal redistribution. What does that mean to you?
Fiscal means money. And fiscal usually has 2 sides, a tax side and a spending side. So our fiscal system is our system of collecting money and spending it. So that's what it means. And everything we've been talking about today is about the fiscal system.
I think he might have meant maybe if you want to comment too on the redistribution aspect, because the resolution specifies that. What they mean together.
Well, they're imagining that government would be the actor, and therefore it would collect taxes and spend money. But there are many, many ways, of course, to do that. I'm just saying there's nothing special about the word fiscal except that it's referring to collecting money and spending it.
Awesome. Okay, well, we have about 4 minutes left. I think there's one more question coming from Marna, but in the meantime, are there any other students? If you guys have any more questions, feel free to put them in the chat. Oh, Marna said thank you. But if we don't have any other questions, we're approaching the end of our hour time. I guess, John, is there anything that you would like to leave the students with, or maybe a comment on some of the dialogue that has happened during the question answer period?
Well, I'm interested in what kind of cases you all are finding that are successful, and what are the cases that are most popular? What are the problems with those cases? If you have time, send us an email, and that will help me know what would be useful to put up at our debate site, and that kind of guidance would help us better help you all.
Yes, yeah, I totally agree. Yes, and Marna said that they will follow up on the case list. And to John's point, that will be very, very helpful for us, and especially for Dr. Goodman to come up with even more specific arguments and ideas for the various affirmative cases that are being run. Remind me, are you guys going to nationals? Marna probably will shoot me a text. If that is the case, then, and I know nationals is happening here in June. And yes, Marna said they are. So yeah, we would definitely love to update and, fix our debate site to be more applicable to the specific cases. And we did just get a question, why not do a tax on solid pollution, plastic, metal, etc.?
Well, but what's the point? Plastics can be a pollutant, but plastics are also very valuable in products, and same thing for metals. So you have to be careful about what you're trying to do. The carbon tax was clear. We know that carbon is used in lots of different ways. We put a tax on it, and people will reduce their use of it, and they will do it in the most efficient way possible to meet their aims.
Or any other commentary from you, Dr. Goodman?
No, I've enjoyed it.
Okay. Well, thank you guys so much. We really appreciate y'all. And we hope that this was instructive and informative. And I know Dr. Goodman probably had a great time talking about, his life's work and the work that he's doing with the Goodman Institute.